Communication and safety have a very strong relationship, and it begins from how a patient establishes trust with a physician, how that relationship is established. So you can imagine that if I don't trust a physician that I work with, that I'm not going to give essential information to that physician. In fact, I may test the physician first to see if I trust them so that I can give very sensitive information or critical information. So I think that's one of the first things. And it begins from the minute that you walk in the front door to meet with the patient. If they don't trust you, they're not going to give you what is most important. And that has a role to play in accuracy of information and making sure that you gather the right amount of information to decide on how to treat a patient. Similarly, if a physician doesn't ask questions in an open way and doesn't take into account the patient perspective, you can also have missing information to get to an appropriate diagnosis and a treatment plan. So there's a huge link with patient safety and communication skills. As well, if you don't explain things in a way that the patient can understand and remember, then they may not, or even if you haven't taken the time to make sure that you agree on the plan together before they leave, then they're not likely to then go ahead with your treatment plan. So you don't know if your plan was successful or if it was just that the patient didn't understand. So that also has an implication for safety as well. Or perhaps they've taken the medication in the wrong way, and so that has implications as well.